While Pfizer awaits the official go-ahead from government regulators, the drug maker is already producing pediatric doses of its COVID-19 vaccine. The doses for children will be specially marked with orange lids so that they won't get confused with adult doses.
And today we learned more than 1 million doses will be ready for children here in California in the first week after they are okayed by the CDC. State health officials say that they've already ordered more than 800,000 doses, and the state is partnering up now with thousands of providers all across the state to give the shots. About 4,000 sites are already ready to go.
Now, this comes as Governor Newsom is urging Californians to get their booster shots today while getting his own in Alameda County. The governor received a Moderna booster shot after being fully vaccinated with the J&J shot. He said he is hoping more people get vaccinated before the holidays.
We know vaccine confidence takes time, and we have to build that. And it's important that we have answers to a lot of parents who still have questions and are going to still have questions about the vaccines. But as soon as the vaccine is approved, we'll have material, we'll have answers to frequently asked questions so that parents could get answers to their legitimate questions.
Health officials say vaccines are the key for putting this pandemic behind us. And now that we're closer to the approval for children, many families are looking forward to that extra layer of protection.
Let's check in with KCRA 3's Brandy Cummings. She's been going over this plan for how we're going to start vaccinating kids here in California. She's live for us right now from the newsroom. Brandy.
Yeah, Gulston, Lisa, today state health officials said approval of the vaccine opens up vaccinations to 3.5 million children in the state. They added that vaccinating children 5 to 11 means another 9% of Californians will be vaccinated, and it'll get us closer to ending the pandemic. Now, to put things into perspective, more than 6 million children in the U.S. have been infected with COVID-19. There have been more than 35 pediatric deaths in California, and that means the state is seeing more deaths than the flu. Yesterday, the CDC noted that COVID deaths in the 5 to 11 age group put them in the top 10 for causes of deaths in that age group. State health leaders said the state has 4,000 states already prepared to give those shots after they're approved. 860,000 doses of the vaccine for young children have already been ordered for California. And today I spoke to the White House vaccine coordinator who says there are lots of parents who are already prepared and ready to get their children vaccinated. But I asked how the White House is planning to convince other parents.
We know vaccine confidence takes time, and we have to build that. And it's important that we have answers to a lot of parents who still have questions and are going to still have questions about the vaccines. But as soon as the vaccine is approved, we'll have material, we'll have answers to frequently asked questions so that parents could get answers to their legitimate questions.
And the state is encouraging parents to call their children's pediatrician or local health care provider. The state will work closely with local health departments, clinics, and even schools so that children can get the shots in a familiar place. Live in the newsroom, I'm Brandy Cummings, KCRA 3 News.
Yeah, so Brandy, what still has to happen before the vaccine is approved?
So there's still several steps. So yesterday, a panel of vaccine advisors to the FDA recommended the Pfizer vaccine for kids 5 to 11. The FDA will then take that vote under consideration. Meanwhile, advisors to the CDC meet next week. They will be discussing the issue, but ultimately the last word from federal officials comes down to CDC Director Dr. Rochelle Walensky. If she gives the nod, vaccines for children could start a few days later. But again, keep in mind, in California and other Western states, a panel of scientific experts would then have to endorse that decision.